Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to be here with Dr. Elias. Dr. Elias is an interventional cardiologist, and we want to talk a little bit further about what he does, what his training is, maybe a little bit, and some of the really great early success he's had here at Thibodaux Regional. Why don't we just talk a little bit about what is structural cardiology?
Sure. Interventional cardiology is a specialized, so I'll touch upon the interventional part,
Yes.
and then we'll kind of go up to the structural part. So interventional is a subspecialty of general cardiology where you're actually dealing with, it's more procedure-based heavy. You're in the cath lab, cardiac catheterization lab, where you're actually, your bread and butter is involving putting balloons and stents in people's heart arteries. In addition to that, we do there's a subspecialty within the interventional cardiology division where we actually deal with what we call structural heart disease. And structural heart disease basically involve issues with either the valves within the heart, so the most common one being the aortic valve, usually being usually tight valve. As we get older, calcium deposit builds over, or if we have a congenitally what we call bicuspid valve, it tends to actually grow at a much earlier age. The technology has evolved so much that we can now do that with a catheter based. And by that is basically going through the groin and the right femoral artery, you stick a catheter in there, and then through that you go all the way back up into the aorta, back into the heart, across that valve with a wire, and then you go in, you balloon it open, and then finally put in, well, the most commonly valves that are out there are called either Medtronic or Edwards valve, so the Sapien or the core valve. And these valves, you basically replace the old calcified valve. You just push it apart, and this stays in and acts as the new valve for them.
That's amazing. Yeah, so you can extend people's lives, you can make the quality of their lives much better.
Correct.
Get great outcomes from that. And so your training in that structural area allows you to replace valves and fix valves that are broken,
Correct.
so to speak, calcified.
Yeah, so in addition to that is, so the aortic valve is the most common one. You'll hear the TAVR program or TAVR, also known as the TAVI program. I think that's mostly in Europe, that's what they call it. So program have developed almost all over the country where you don't have to be fully doing structural heart, all the structural aspect of the heart.
Some complicated stuff.
Yeah.
Well, you're well trained to do that, and sense a humility and a confidence about you and performing your work. And things have changed with the advent of new technology, training young doctors like you that can perform those things in regional medical centers like Thibodaux Regional.
Yeah. So again, I'll kind of touch back on how I think Geisinger was similar to Thibodaux in a small area, and they started off with very small and kind of grew into a bigger center where they're actually doing a lot. And I see the exact same thing here, I think. And I don't think any patient would like to, travel out to get their care done elsewhere. They prefer to stay home and have their care done at the best center. And I think here we are hopefully developing that.
I agree with that.
Yeah.
And so we have a vision for cardiology. You're very much a part of it. We have a couple of other cardiologists involved, great guys, and a number of other very competent staff and new technology that we've acquired, such as PET CT scanners that traditionally were used for cancer diagnosis and treatment. But we again welcome you, Dr. Elias. We appreciate having you here.
Thank you.
All your skills and abilities, and we'll talk more in future editions. Thank you.
Thank you.